chairs these sessions. Oh, sorry, I pressed a button. I didn't know what it was. So Councillor Sheth chairs these sessions, amazing chair, really, really knowledgeable, really connected. And, you know, we're, not that you can see, but I'm holding my heart here. Thank you for all the work that you do for communities in Brent, but also across London and across the country.
Thank you so much, as always, Judith, for that wonderful, wonderful introduction. Can I also add my welcome to all of our friends this evening, and my special welcome to Claire Murdoch, CBE, and Gareth Jarvis too.
Good evening. Good evening.
I'm incredibly proud to be lead governor of Central and Northwest London NHS Foundation Trust, or CNWL, working with Claire, Gareth, and the team to help them support in tackling one of the greatest challenges facing our society. Mental health isn't a dirty word. We all need to take care of our mental health, just like we do physical health. Not seeking help at times when it all seems too much can impact the rest of our lives. Put simply, I want us to make asking for help no longer a big deal. And so I'm grateful to the Advocacy Project and Healthwatch Brent for bringing us together to have this conversation. I know 1 hour is just not going to be enough for this hugely important topic, but this is just the start of our conversation. On my journey as chair of Community and Wellbeing Scrutiny Committee, I have seen the difference that a listening ear can make to people's lives, whether a father supporting a child suffering depression, a mother managing a household budget with the current cost of living crisis, or a young person struggling with the pressures of school exams. Personally, I see how amazing NHS colleagues are helping and supporting residents through traumatic moments. I have learned a lot in the past few years as I have met people, particularly following the Grenfell tragedy and the recent devastating impact of the pandemic. The conclusion I am coming to is that the more we all talk about this, the more collectively as community we can do to support each other. The theme of our conversation this evening is, how can we avoid mental health crisis? To me, getting early support for people before what they are going through becomes more serious or even clinical is hugely important, without stigma, shame, or judgment. That support can be as little as a conversation, or it can be signposting someone to a professional service. Those actions may seem little, but they are very important, and there shouldn't be any barriers too. However, people with serious illnesses often face barriers and are discriminated against. But it doesn't have to be like this. I know Claire and Gareth are absolutely champions for new and better treatments, such as open dialogue, home treatment, crisis cafe, and even step-down beds in a hospital setting. And we'll be hearing from them very shortly. Also, friends, a new Mental Health Act is coming, hopefully with more choices for the seriously ill, with fewer detentions and making least restrictive option for caring, the best one, with modern services making that a reality. So anyone with serious illness, like any other long-term condition, should have that extra support to be themselves and live their lives, because that way a crisis can be avoided. In my role, I am fortunate to meet so many inspiring people who have been there for friends, colleagues, and family at that crucial time in their lives. And how amazing it is to have two of those inspiring people with us this evening, Cllr Murdoch and Dr. Gareth Jarvis. Friends, Cllr needs very little introduction, but let me remind you, she is still a mental health nurse, Chief Executive of CNWL, as well as National Director for Mental Health for England. Gareth is a consultant psychiatrist and Divisional Medical Director, also at CNWL. I know how busy you are, Cllr and Gareth, but I'm so grateful to you for joining us. I know we are competing this evening with Northwest London ICS Residents Forum, and we are going to be finishing on time because we've got a football at 7:30. Cllr and Gareth, if I can ask you to spend about 15 minutes or so and giving us an overview of the work that you are doing to help people avoid mental health crisis and supporting them during crisis. After those 15 minutes, we'll spend the remainder of our time with some quick questions and answers, please. So without further ado, let me ask Cllr and Gareth to please share some of your thoughts. Thank you very much.
Well, thank you so much. And I've got my watch in my hand here to make sure that we don't go over 15 minutes and that, in fact, we really do leave time for questions and discussion. So I'm intending to maybe take 5 of those minutes to talk more generally about what we're doing, and then hand over to Gareth to talk more specifically, and then we'll open up to questions. But just before I start, I just want to say a huge thank you to you, Ketan, because you are an absolute champion for, well, the people of Brent actually, but also in particular for mental health. And I'm hoping that as we discuss things throughout this evening, we're all really interested in mental health and equalities and inequalities. And I think you'll hear what I'm about to say in a minute, but the issue of stigma, the issue of tailoring services such that they're delivered by the people for the people, that they have flexibility to reach out to meet individual needs, to take into account spirituality, faith, ethnicity, people from a whole diverse range of backgrounds. And my question for you, which I don't expect you to answer now, but is, what's it like in your community? What is it? Is mental health spoken about there? Is there still shame? You're just such a beacon of let's get this on the table and talk about it. I would quite like to hear from you as well at some point, if you don't mind me throwing it back on you, because I think they're totally inspiring, and I think we have to engage with our diverse communities to understand this is not a one size fits all. Of course, we want to understand best evidence base. Of course, we will want to look internationally and nationally at best in class. But actually, we then have to deeply tailor everything we do to work with and alongside our communities. So I put that question out there to you, along with my thanks. Just very briefly then, if I might, and I say these few things with both my national director hat on, but also my chief exec hat on. And you're right to say I'm still a registered mental health nurse, and it occurred to me that next year it will have been 40 years that I will have been working in mental health, and I've had the fire in my belly belly and a passion for this all those 40 years. And sometimes I felt we've made huge progress and there's been much to celebrate. Other times it's been frustrating. Whichever, let's all be really clear, we've got a lot further still to go. So we've got some hard yards still to do, but it would be good to talk about what we're doing now, what's on offer now. Just a few points from me, if I might. I think the stigma thing is still such a horrendous burden. And I want to pay tribute actually to everybody living with mental illness or mental health problems, to their carers and families and those who love and support. And I particularly want to pay tribute for all that you've done throughout the period of COVID, which has been extraordinary. And I think part of why I've worked in mental health for 40 years and still have that absolute fire in my belly is because the people you get to work with are amazing and inspiring and actually often very humbling as well. So I do want to say a big thank you. I absolutely know we cannot deliver world-class mental health services in Brent or in Northwest London or in this country unless we do it with and alongside the people we're serving. So some of the things that are really changing that Gareth might say more about in a lot of detail is our workforce. Who are we recruiting from? Who are we asking to come and work in mental health services? And we absolutely are increasingly trying to employ community connectors, link workers, people from local areas who can connect us into their neighbourhood, their locality, their community group. We're also trying to employ more people with lived experience, more peer support workers across the piece, so that the voice of service users, whether it's in A&E, on our inpatient wards, in our community teams, is employed by us, that they're workers that have a proper salary, parts of the team, and who have loud voice, an impactful voice to change and shape the way we operate. So we're employing there. The other area we're employing in really are people who, of course, we want to employ more doctors and nurses and people who've got degrees and so on and so forth. But we're also increasingly working with local colleges and others on cadet nurses, for example, as one example of people who might have flunked their GCSEs and A-levels because life was happening to them, but who've got great values, who are bright, who are streetwise, who are savvy, who care. And so we're really looking at, can we recruit from our local communities more, from different groups, to really be able to capture the full extent of the great skills and assets that people bring with them. So it matters to us that we can be an anchor institution. I do call upon, before Gareth talks about what we're doing, employers, schools, our local authority colleagues who are so important. Mental health is all our business. The NHS can't do this alone. Faith leaders, community groups, being able to intervene early and differently really makes a difference. The impact on the economy, on worklessness caused by poor mental health is devastating. So employers, for example, as well, really need to step up and take this seriously alongside us. There are things people can do that I just want to draw people's eye to that can help themselves, or if you're sitting here thinking you know someone who might have a mental health problem, there's lots you can do now online, such as Every Mind Matters. It's an evidence-based assessment tool, fully confidential, where you can go in as an individual and it'll ask you various questions. And if you're a bit worried about yourself, it'll give you a mind plan at the end of it, and it'll indicate whether you should be seeking further help or things that you can do to help yourself. Things like psychological first aid, community groups, employers, teachers, others can get psychological first aid training free. It's evidence-based, and wouldn't it be great if we aimed to have 1,000 people in Brent who'd done that training, who could help support people with mental health problems. Physical health and mental health. One of the great inequalities of our time is that people with serious mental illnesses will die or live with poor quality health. but will die some 15 years earlier than the average because of poor physical health. And so we're doing a great deal working with primary care colleagues to improve physical health. And it really matters that we do that. You know, there's no mental health without good physical health, but there's no good physical health without good mental health. So we're focusing there as well. And on the new Mental Health Act, I don't intend, maybe one day we will run a completely separate seminar on what it is, but just to say some things that my national team and I have been working on around the new Mental Health Act is the whole gearing of that act is about moving to a rights-based set of legislation as opposed to a risk-based set of mental health legislation. It seeks to give a far greater role to advocacy, service users and their voice, and to, whilst people are well, if they have a serious mental health problem, they make a plan for when they're next ill and what medication they want, where they want to go, what treatment they do and don't want. So I think we're on the brink of a really exciting sea change. So I think they're the things I want to say for now. CNWL has invested a huge amount of additional money in mental health as a result of the national long-term plan, which I'm very proud of. Over the last 4 years, we've had an additional £40 million to invest in mental health in northwest London, nearly 10 million of that, or more than 8 million, certainly in Brent, growing our services across the base. And all of that is intended to grow new models of care, make access easier, work with third sector organisations and others. And Gareth's going to just tell us a little bit about what we've been doing in Brent.
Thank you very much indeed for that, Claire. Really, I'm grateful to you. Gareth, thank you.
Hello everyone. Many of you will not have met me before. I'm Gareth Jarvis. I'm Medical Director for Jameson Division. And so that's the division of CNWL that leads the adult mental health services and learning disability services across Brent, Harrow, Kensington, Chelsea, Westminster. And I've been in this role about a year now. And before that, I had about 10 years working over in North Central London. Many of those years were spent as a crisis team consultant in Haringey. So although Brent is unique and very different, there's many things about the diversity of the population and the challenges that our services can face here that feel very familiar to me, coming and working here. And actually, that one day a week, I keep a clinical working day and I base it here in Brent, because this is where I care about making sure that we are focusing on where our inequalities are and improving them. I think we're hugely fortunate to have Claire as our CEO for this patch. She has been a hugely effective national director for mental health. I remember, I often tell this story, that when I was a crisis team consultant, just joined, and Claire was a new director for mental health, she came along to our conference and said, I will be getting more monies to your front line for crisis services. And I went skipping back to my medical director at the time and saying, Claire's told us we're going to get more resources. And he just kind of shook his head at me and said, well, we'll believe it when we see it, Gareth. But sure enough, a year later, we expanded our team by 30%. We had the new resources came to the front line, and we started to really feel a change in what we could do with our services. And over the work that Claire's managed to deliver with this community transformation that's happening nationwide is just a fantastic thing to see. It's something it felt very different this last 3 years compared to the decades before. And what that's meant is that in CNWL, we've managed to really do a bit of trailblazing work on how we transform our community services. And so we're really ahead of the game of a lot of places in the country now. And we're following the Community Mental Health Framework, which is a document that's really tried to put a new vision for how we should be doing our work within mental health services, and going to something that is much more place-based and getting to be really connected in with our communities. Because what fits for one person will not necessarily fit for the next. And if we're truly doing collaboration and co-production, we need to be working with all of you. And you need to help us understand, how do we make our services more accessible? It's not that communities are hard to reach, it's that our services aren't constructed in the right way to help you. And so we need to work with you to help do things differently. We've got a multi-award winning team here in Brent, the Health Inequalities team that was set up during COVID. Hugely impressive work that they've been doing in trying to get alongside your community leaders here. That work is still in the foothills. That there's so much more to be done in helping us understand and the changes that we'll need to grow from it. But if this kind of stuff takes time to grow relationships in a meaningful way, does take time to work closely with you, and I'm hugely pleased that we're making progress with that. One of the things that we have done is we've built these community mental health hubs that are now based around clusters of GP practices in local communities, so that we get to have the intelligence from our GP partners to really help us understand what are the challenges they're facing within their communities, to make those links with the community leaders in those areas. And that includes our faith leaders, our community organisation leaders. So we need all of you to be engaged with that in helping us understand how we do things in your particular area. We've employed new workers within the general practice area. They're called additional, I'm not even going to be able to remember the acronym now, they're called R's roles, so it's a terrible name for them, but they work there out in general practice alongside our GPs, being a much sooner accessible resource to the community of getting advice quickly on mental health. And within the services that we've got, that word crisis has always been really important to me when I used to try and sit with the crisis team and understand what was our role and what was the work we were trying to do. The Greek origin of the word crisis actually comes back to something that translates not to crossroads, and I think there's always that's a really useful metaphor, I think, for thinking about crisis, because there's an opportunity in the moment of crisis. There's an energy that comes with it. It's usually getting us to a point where people are feeling something needs to change. And so there is opportunity for all of us to think about, as we notice somebody heading into or emerging into a mental health crisis, that actually there is an opportunity for us to work closely with someone and do something different. There's a time for change. All of you here can have a role in that. When I go around to various forums talking about mental health, I often get people to put up their hands to say, if you have personally or someone close to you has experienced mental health issues, pop your hand up, and every hand in the room goes up every time, because there is no them and us when it comes to mental health issues. There's only us. Everyone's lives are touched by this as an issue. And I'm really interested in how we get to make sure that everyone is included in the way that we deliver our care. So we have done this restructuring of our services. We've got loads of great new roles that Claire was alluding to there before, about our peer workers, our community navigators, our R's roles. And we're going to have new approaches that we bring into that care now as well. So that's going to involve things like using the dialogue tool, which asks you for your data, for you to rate how you're experiencing the different aspects of your life, and then do a co-produced care plan with people. It involves us using new technology. There's an algorithm called MAST, which it crawls around in the background of our note system and helps predict when people are heading towards crisis. It feels very 22nd century to me, let alone 21st century. But it's a really interesting tool that teams can actually help be more proactive in anticipating people's needs and going in to give more intensive support when people are heading there. We're still in the early days of understanding how we use that technology, but it's going to be a growing feature. But my own particular passion is about an approach called open dialogue. I'm sure Ketan might give me some space to answer a question later about it, but it's about a family inclusive, social network inclusive approach to mental health care. And that does take some retraining of our staff. We're sending over 100 staff away on the training this year from CNWL, big investment from the trust and a real investment in doing things very differently. So I'm hugely excited about what we're doing there. And we are very proud of what's being achieved in Brent. We know there are lots of challenges and inequalities. However, it's a really vibrant community. We have a brilliant staff who come from the community who work alongside us, and they're passionate about making things better for the people we serve. So I do think we're at the verge of seeing some really great changes coming now.
Thank you very much indeed, Gareth, for that. A very, very interesting insight into the work that you are doing right here in Brent for our residents, our communities, but beyond. I want to pay my and my fellow colleagues heartfelt appreciation of all the work that you and your team right across the borough are doing. So thank you very much. So we do have, we're going to try and make as interactive as we can. I know there are a whole lot of messages on the chat. So thank you very much. Keep that going. And I will try and pick up one or two questions. But it may be just easier if you want to raise your hand physically or virtually, the yellow electric hand, and I will bring you into questions. And we do have, if you are using social media, Judith, what is the hashtag again? We do have a social media Twitter hashtag. I think it's healthy communities. Is that right?
Yes, it is. Healthy communities. Hashtag healthy communities.
Perfect. Thank you very much for that. So we're going to now spend the remainder of our time that we have. And I told you 1 hour was never going to be enough. And the time is, already fast catching up with us. But let's make the most of the time that we have. And we'll come back to this particular topic some other time. To look at it in much more detail, and hopefully Cllr and Gareth will be able to join us for part 2, if I can phrase it that way. But let me kick off with some questions. So in my opening remarks, Cllr, I alluded to the fact, I reminded us that you are still very much a practicing mental health nurse. And I just wanted to understand, how important is this for you and why?
Look, when I became a mental health nurse all those years ago, I didn't know anyone else who did it. I didn't really know what it was about, but I was hugely interested in this issue of stigma and a feeling that anyone could become mentally unwell, and wanting to understand it and make a difference. And so when I qualified as a mental health nurse all those years ago, it became everything I learned, the people I learned it from, the patients that I encountered, their family, seeing the closure of the big institutions and how horribly institutionalized and locked away people were, seeing how all of us as a society and as professionals and service users and their families tried to create new models of care, I suppose really embedded in me a sense of my identity as a mental health nurse, a pride of working in mental health services. Look, many times in my career, people have said, oh, you're really good, you could work in an acute trust. I cannot even begin to tell you how anger-making that is. That just made me all the more determined to spend a career in mental health. I love working with community services, my acute colleagues, but it's part of my identity. It's part of what's driven me. I'm really thrilled at how far we've come, but we have so much further still to go. And I want that to be a strong part of my driving force, my North Star.
Thank you. Thank you. And talking about the driving force, Cllr, you asked the question about how it is in the community that I come from.
Yes.
And as a person from Indian heritage, I would say that there is a huge, absolutely huge, and I know there are a lot of other colleagues and friends on the call right now who will vouch for this. There is huge stigma which still lingers like a bad smell. And I think, in my opening remarks, I was saying that there shouldn't be any barriers. I just want us to be able to ask for help. without feeling ashamed or without anybody judging. And I think, both you, Cllr, and Gareth have, just set out for us some wonderful example of some of the great work that is happening right at our doorstep. So I just wanted to, ask you, both of you, that how mindful are you when you are designing and delivering the services? Because you talked about a wide range of services. I'm interested very briefly in understanding how sensitive are you, particularly in place like Brent. We are hugely diverse, and I think we do still have that great big challenge.
Yeah, I'm just going to say something very quickly because I'd like to come to Gareth to answer that, because he spends a lot of time with his frontline colleagues helping to steer the design of services. But as an executive director and as a national lead, and that community framework that Gareth was talking about earlier, if we cannot evidence that we've listened to communities and involved them in design, then I think we're absolutely failing. And we learned during COVID, didn't we, from Church End, the Church End community,
yes,
where so many people died of COVID and there was such fear, and yet health agencies felt remote. And, actually it was only through sitting with, listening, responding to the needs there, then employing people from within, asking imams to come and help us, looking at what was important. We completely co-designed something that I think feels very different now in terms of the whole range of health and how we help improve health in that neighbourhood. And it is at the level of neighbourhood that we need to wear our shoe leather out, going to where people are, to ask how we design services. And I've been so impressed by Gareth since he joined. He's in a very senior role in the trust. In a smaller trust, he'd be the medical director, and I have no doubt that he will be a medical director one day. But he really wants to introduce things like dialogue and other things that he'll say something about. You can only introduce that with people. But say something about more what it is, Gareth, maybe.
Thank you. And Gareth, I know firsthand the amazing work that is being led right here in my own patch in Church End, and I hasten to add also Alperton. But yes, please share your thoughts and perhaps tell us a little bit more about open dialogue. We have got, looking at the clock, we have got about 20 minutes left. So I think I can see a whole lot of hands going up. So we're going to have to be super quick with our questions and our replies, please.
I'll try and do the 2-minute Redux version of what is probably a 2-hour lecture. Open dialogue, it's an approach that started in Finland. I trained in it about 6 years ago, and it's a family systemic way of working. So the first question that you ask when you go towards someone is, who's important to you? And then you try and gather those people around somebody and work with everyone that they define as being part of their social network. So it's by its very nature, from the very beginning, an inclusive way of working. And so that could be including your imam, your school teacher, whoever needs to be there to be part of making sense of and meaning from the experiences having with someone. So it's a completely unique experience every time that you co-construct with it. Instead of, I think if you wanted to stereotype mental health care of the last century, it was an expert talking down to somebody. It was sort of one-on-one, individualized. The way we would understand mental health now is much as mental health problems can be within us, they can also be between us. And so if you actually really want to tackle mental health issues, you need to be working with the overlapping people who are important to someone to fully understand issues and to find the solutions. Yeah. And that's the one of the things I've really loved in working this way, is that the social network finds the solutions for us, not us as experts trying to come in and talk to people about it.
Thank you.
And so it's why I'm so passionate about it being a real change for the way we're working. I think it gives us a lot of hope for the future. It is a complex change, though. It's a lot of retraining our staff into giving them new techniques, new skills, new ways of thinking, but also our communities as well. They come with their expectations. We've set them up for these expectations over the last 50 years of they will see a doctor and be given a prescription, and actually introducing them to some new expectations of you're all going to be part of this and we're all going to find solutions together does take a bit of a shift in mindset for everyone. So
thank you.
Yeah,
thank you very much. I can see lots and lots of hands going up. I'm going to take one or two of those, and if we can be please quick with the questions. So Dr. Achi Kong. Good to see you. Thank you very much.
Hi. So I'm a resident in Brent. So spent 30 years as a GP in Church End. So I'm really glad that interventions have happened in Church End, and with Claire mentioning that due to co-designing, improved health has happened. So thank you very much. My question is related to my community. So stigma and taboo are very much high on the agenda in the East Asian and Southeast Asian communities. Normally they're not like me. They're usually very quiet people with heads down and do not want to bother anyone. But we know that there are mental health problems across all communities. And the reason why I'm asking is there'll be 500,000 migrants from Hong Kong coming into the UK. So how culturally sensitive will be the services to these communities? That's number one. And number two, I want someone to explain to me the difference between emotional health and mental health, because a lot of people will say, I don't have mental health, I got emotional health. So
thank you.
Yeah, so explanation on that, please. Thank you.
Thank you very much for those wonderful questions. No, and I'm just going to come to Claire and Gareth for a quick response, please. Thank you.
So Effie, I think we'd want to work really closely with you, because I suspect you have far more insights into the community you're serving than I would ever have. And so we would want to be coming alongside you closely to help us link us up with the right people, to start planning together. It's really great that you're horizon scanning there. So often we're reacting to issues rather than anticipating for the future. And you're there very rightly pointing out big influx of migrants from Hong Kong, going to have a whole new set of issues that we need to tailor our services for them. So we'd really want to work closely with you and other leaders from the community on thinking about how we make a service that fits for them. And I think this issue of stigma, it exists in all communities, I think, and a huge part of stigma comes from self-stigma of the people, what people put on themselves. The more we can talk about it, and as leaders we talk about it within our communities, the more we can start to break down those barriers.
Thank you.
Yeah.
And the second point, Gareth, about the emotional health.
So isn't that interesting? I think we're in a real sort of transition phase in psychiatry in the way that we understand mental health issues. I think we had a very biological model for many years there that sort of went for a diagnostic, and I think people are very rightly challenging that and saying that's too reductive. It doesn't give the full description of my experiences, and people are often talking about their emotional experience, and sometimes the medicalization of mental health problems doesn't help with that, because it cuts away the emotional side of it. It's one of those things that we really need to help us retrain our staff to say, actually, emotions aren't a bad thing, something we need to connect with, be open to, work with, and share our own personal response to that. That's a big part of.
And just to very briefly say as well, I mean, we're investing in mental health support teams in schools. The curriculum around education in schools has changed such that now mental health is actually on the curriculum in schools, and I do think the younger generation, not saying you're not young, Effie, but the younger generation, I think, will have a different set of expectations about how they can talk about how they're feeling and so on and so forth. So I think the dial's moving. I would also like to put a bid in for us not being too scared to use the term mental illness sometimes, because I think there's a spectrum, but we're investing heavily in schools at the moment as well.
Maybe I'll come back and pick up on one or two points that you made, Claire, if we have time. But let me take one or two, let me progress this and take one or two questions from colleagues. So Sandra Kabir, please.
Good evening. Good to see you too also, Ketan. I had 2 points, but I'll bring up only one in the interest of time. I'm a councillor, elected councillor in Brent, and I come into contact with people every day and in quite large numbers, individually plus in groups, etc. One of the issues I do hear from people is that I may refer people maybe to IAPS or to bereavement counselling or services like that. But then they will come back and say, oh, I went to one session and it's not really for me. So they drop out. So what can we do about that? Because I hear this very frequently.
Thank you. Thank you for that, Sandra. Wonderful question. Gareth, please.
So, Sandra, I'm really sorry. My internet just blipped. And could you just repeat the core question again for me? Because you just paused for me.
Yeah, very quickly. As a counsellor in Brent, I come into contact with a large number of people on a daily basis. And one of the common issues I hear from people that I refer for services like bereavement services or IAPS is that they go to one session and then they say, oh, it's not for me, and they drop out.
Thank you for that.
It's something we're always looking at. So we're constantly monitoring things like dropout rates for our IAPS services and our access rates. It's something we definitely need to be doing better on at the moment. Post-pandemic, we've not managed to pick up the people who are accessing our services enough. So if there was a message I wanted to get out there today to everyone here, to our communities, is please do encourage people to go through to IAPS. But we will need to be working closely with them as well to be adapting their approaches so that they fit for they're culturally appropriate, that they speak a language. We also need to be making sure our workforce is reflective of our community, because whilst most of our mental health workforce is very reflective of our community across Brent, our IAP workforce, but not as much, and so we need to make progress there. So I definitely think there's work to be done, but do please encourage all your communities to be accessing.
Thank you very much for that. Thank you very much for that. Chris, please. Chris Sanford, very good to see you.
Good evening, everybody. My background is HIV for CMWL. And a large percentage of our patients at the Mortimer Market Centre came from Brent. So I really welcome the advocacy project. And there was so much stigma around HIV that it causes psychological well-being problems. That's my term. And, and so I think we need to look at, include that community, please, advocacy project, because it's very difficult to get people into talking therapies when they're dealing with two kinds of stigma. It's really a point I wanted to make, Ketan, rather than a question.
Thank you very much.
They're both nodding, so I think
thank you.
It's something that tends to get overlooked occasionally.
Thank you very much, and good to see you. Colin Simon, please. Thank you for your patience in waiting. Colin.
Hi there, everyone. I was just reflecting on some of what was said and was wondering, there's about a body of maybe 40 years of research around the disparities amongst the Caribbean and African communities, and how we're really able to bridge that gap, particularly around detentions and the criminal justice system, prisons. It's something I'm really passionate about. And I think with having that emphasis around GPs, we know that community might not necessarily go to their GPs. They're always presenting in crisis. How do we break this cycle?
And there is a bigger question, much more broader question as well, isn't there, Claire and Gareth? I know that you have been advocating and championing parity for all the years that I've known you. But are we anywhere near cracking that ongoing issue around parity?
I think there are different kinds of parity. So one of the sorts of parity when I talk about it nationally, well, and in my chief exec role, is equal investment, so that mental health has the same level of investment, that we tackle the waiting lists as seriously, we make access as easy, and so on and so forth. So parity there. But I also think when it comes to equalities and diversities, what you see in mental health is often underrepresentation of communities who don't come forward, even in crisis where it's buried very deep, and you worry about those people, and suicide rates could be higher. And then an overrepresentation, as you say, of young Black men, very often from Black and African Caribbean backgrounds in particular. And I would say to all of us here that there are deep and structural inequalities that the NHS alone can't tackle, and it's a perfect example of where only if you work with local communities, only if you're working with young Black boys in schools, around gangs, around proper education there, having different services. I know in Brent, and it occurred to me to think about it tonight, that when I used to be director of nursing before I became chief exec, we actually had Black advocacy and Black advocates who, every time a young Black man or a young Black person, but usually men, would appear in crisis in A&E on a 136 picked up by the police, we could call the advocates and they'd come to A&E and they'd work with the mental health professionals and intercede and say, hang on a minute, before you think of detaining under the Act, think about these other things and work differently. So I really think let's be humble about this. We can't do that alone, but we absolutely must work with different communities. We will never change it otherwise. We'll have people secret and hidden and other people over detained on the Act. Together would be my one word.
Thank you very much.
One of the things, just quickly to put in on that, Ketan, is that part of this big investment we've been talking about into our community services has been about us investing into our voluntary and community service sector. So a really great example in Brent is the Silver Jubilee Park football team. And we've actually put some money directly there because we know that's a way of us accessing young Black men, for example, in a way that they wouldn't go to their GP, but they would come along to have a kickabout in the park, and we can talk to as part of that, have a talk about mental health as well. So we are trying to really innovate in the way that we do what we commission and support, to make sure that we're trying to reach out in new ways. So if you've got ideas of things that we should try and work on, let us know.
Thank you very much. Solomon, thank you very much. Millie, you just taken your hand down. I don't know, so you got fed up waiting, but I promise if we have time, I'll come back to you. Solomon Cole, please.
Good evening, sir. Good evening, everybody. Yeah, thank you very much for your time. And just a quick question regarding the family element and the proposed changes to the Mental Health Act. Would the name for the new act, would that be mental health? And also with regard to the family element, how do you propose to implement that?
Thank you. So Claire, you mentioned in your presentation about the Act, and I would be curious to have your take on it. Is this going to be a game changer? We've heard a lot about stigma. We have heard about parity, and I would be interested to find out what your views are about this new Act.
Yeah, well, let's be clear, it's still being drafted. So we won't know all of the answers yet, which is why I'm really keen we do undertake to run a webinar and I would run several webinars so that when it is fully drafted and we've got it and we've got the code of practice that will sit alongside it, we should be falling on that and turn it into, what does this mean in Brent? What does it mean in Harrow? What does it mean in Hillingdon? But what it will likely be called a Mental Health Act, and I haven't heard a suggestion it will be called anything else, but I'd be interested in views about, is that okay or isn't it? But the really driving thrust, and Professor Simon Wesley, who was, in fact, it was Theresa May who brought him in to rewrite the Act. And she talked about, when she appointed him, about the burning platform of inequality that she felt the Act was founded upon. So her commission to Simon Wesley was to really write an Act that deeply, deeply gave more rights back to individuals and changed the way we operate. I think one of the biggest changes that's intended in the Act is that if you have a mental illness or a real mental health problem and you're in crisis, that actually you have much more power over what treatment you get, that you have more options around not being admitted to hospital, but earlier intervention in the community. And I think these things are going to be incredibly important. They need resourcing, they need joint partnership and community action, they need third sector alternatives, they need investment. So I'm really clear that this Act could be a game changer, but you can imagine when there's a new Prime Minister, I'm sure all of us will be talking to them about how do we implement this Act.
And all of those, plus the workforce.
You've got to have the workforce.
And we heard earlier, a few days ago, about the Select Committee report, which flagged up, highlighted the crisis situation. So, of course, that is going to be a significant aspect of breaking that taboo and innovating the services.
If I could ask you all for anything, it's work with us and give us your expertise, or teach us what you know and work with us, as Gareth has said, but also get people to come and work in mental health. I've worked in it 40 years and I don't regret a moment of it. I've cried, I've kicked the wall, I've been in despair sometimes, but oh my goodness me, I've just had the most brilliant career. And we are trying to create jobs that you're young or people returning to work, or you want a career change, or you're a community leader and we'll find you work. And we'll train you.
Thank you. We've got a few seconds left, and I've got a lot of hands. So I'll take all of them together. So quick points from all of you. Millie, your point, please. And sorry about keeping you waiting such a long time. Millie?
Oh, no, it's absolutely fine. So I'm a peer support worker in Nelft, and I've just started in the maternal mental health service. And I kind of wanted to ask you guys, like, have you got best practice set up for your peer support workers? Because I'm seeing people coming in who nothing is set up for them. And so there's just it's not being used effectively. I've run my own peer support group in the community for 3 years for mums struggling with mental illness. And I know how incredibly, incredibly powerful it is as a tool, but it feels like the horse has got out of the stable before the course is ready. Let's go with that.
Thank you. A quick point thank you, Millie, for that. Quick point from Anne. Anne Freeman.
I'm trying to unmute myself.
Thank you.
Thank you. I think the sound of the phrase finding a solution using open dialogue sounds so good. When will open dialogue come into Harrow? Because we have a very serious situation that we're trying to sort out amicably regarding discrimination of people with mental illness. And it would be lovely. I mean, how is it going to work if there's discrimination and people are not getting anywhere with a solution?
Thank you very much for that. Nadine, please. I'm hoping I pronounced your name correctly. A very, very quick 10 seconds, please.
Yes, my name is Nadine Stewart, and I've been affected with mental illness for a number of years now. And during the coronavirus, it got worse. I just wanted to know, are there any support groups in the Westminster area that you could refer me to so that I could get some help?
Thank you. Thank you very much for that question. A quick point from Linda, Ashton, and Emil, and then we'll wrap it up, please. Very, very quick point, please, guys.
Hello. Yeah, I just wanted to ask, some of us don't want to go to our GP because we think you'll be on our record or something, especially when you're looking for work. Is there any
Okay.
other private sources that we could get help.
We've got a
in terms
session
of-
on GP next month, so perhaps you might want to join for that, Linda. But thank you very much for your point. Ashton, a quick point, please.
Yeah, my family member has got mental health crisis. As everyone has spoken, it's nice to hear you, but in practical, I am suffering, because I don't get the help what I am looking out for. If you go to GP, they are pointing out to camps, and if you go to camps, they say there's a backlog of 18 months to 26 months. You better go to the private. You see, this is what's happening here. And I want to, they said they don't have funds. It's not enough to paint a picture very rosy. I want the solution for that.
Thank you.
When is the solution coming? When the person is going to die? That's
Thank you very
my
much,
pointed question.
Ashton,
If you have
thank
any
you
answers
very
for
much.
that, please.
Thank you very much. And finally, a very, very quick point from you, Emil.
Well, it can't be a quick point. I need to speak to Cllr Murdoch personally. I have met Cllr Murdoch a few years ago. I was in Kershaw Ward. It was hell. And I want to talk to her about advocacy. I want to talk to her about advanced decision. I want to talk to her. I committed suicide. And I'm only here. And I committed suicide because Hillingdon refused me the Cove Cafe for my residents, 15,211. So I want Guy Harmon, who is on there, knows me, he's spoken to me. I'm dealing with Anne Sheridan about Kershaw Ward, but I need to.
So perhaps we can take this offline. Thank you very much indeed. And I'm just going to ask Cllr, and we are over the time. So I'm going to ask Cllr and Gareth for a very quick, very quick point, and then I will wrap this up, please. We are over the time now. Thank you.
I'd like to give Gareth the very last word on peer support workers. I think absolutely we've started a movement and we're playing catch up. I think in CNWL we do a good job. We have the Recovery College. We've got supervisory and peer support and mentoring structures. We're promoting peer support workers. We've got a whole infrastructure, and we've learned a lot from our HIV peer support services as well, where actually I think we're doing a pretty good job, and I believe in the value of peer support workers unbelievably. I think they're in powerful roles, and happy to share more information about that. On access, because I'm going to come to open dialogue and how we're rolling it out, guys. Just on access, let's be really, really clear that at the moment, need is outstripping, if as it were, supply. So the reason that this is an NHS England priority and a CNWL priority to get additional money and grow the workforce is precisely because we know that the thresholds for accessing care are too high. And so why we're spending some of that money on community groups, on cafes, on coves, on support groups is to try and make access much, much easier for people, whilst the investment and access to specialist services increases. And I can see each year that we're seeing more people than we did the year before. So I know more people than ever before are accessing services, but I also know that too many who need them still aren't, and that we've got a lot of work to do. So I just wanted really to say those things.
Thank you very much. 10 seconds to you, Gareth, please.
And I just wanted to really acknowledge, I've had a lot of messages in the chat directly to me from people from there, sharing stories of experiences that feel like they were very, very difficult and didn't meet expectations. And I just wanted to say, it breaks my heart every time I hear a story like that. Services are challenged, as Cllr was saying, but we are so passionate about improving this, and there's never been a better time to. It's now on everyone's lips. All the politicians talk about mental health now. You hear about it from all the various celebrities. Taboos are breaking down. It is talked about more in society. We will see resourcing flow into this area. We are going to get better at it. And
thank you.
Yeah.
So guys, thank you very much. Thank you, Cllr. Thank you, Gareth. I told you, I did say at the outset, that 1 hour was never going to be enough for this very, very complex area. But nonetheless, I am grateful for all for your contribution. And as I've said at the start, this is just the beginning of our conversation. Action is needed, and I think it ought to be measure of our civic society that most vulnerable people are helped and assisted to be the best they can be. It perhaps starts with health, but actually goes much, much wider. Friends, all of us have mental health, so we all need to get behind each other so that we can help not just individuals suffering, but also their entire families and colleagues as well. And I am so grateful that we have leaders, NHS leaders like Cllr and Gareth, who are clearly doing some amazing work, but a lot more still remains to be done. And to help avoid crisis and to build a better health equality. We all have a role to play, as Cllr has said time and again. We all have a role to play. The challenge is great, but when we work together, we can achieve great things. And most importantly, save lives. Friends, we will be back next month with another session around tackling health inequalities. This time is going to be with Dr. Chand Nagpal, who will be talking about access to GP and how do we get that important face-to-face appointment with our GP. With that in mind, I will apologize for running slightly over the time, which I wasn't hoping to, but very quickly, last and final word to Joe, and thank you all. Joe?
Thank you, Ketan. Yeah, so just on behalf of the Advocacy Project and Help Watch Brent, really such an interesting discussion tonight, and we'd like to especially thank our speakers and Ketan for hosting the talk. So we will share the recording on YouTube, and please do share that on with any colleagues or friends, family who couldn't make it here tonight. And like Ketan said, our next lecture is at the end of August, and we've posted the link to book in the chat, and we'll also send an email around. So yeah, wish you all a safe and happy evening.
Thank you very much. Enjoy the rest of the evening and the football. Thank you. Bye-bye now.